I'm a gastroenterologist and I do not believe in the diagnosis of IBS. Not because your symptoms are not real, it's more because most doctors use the term IBS when they don't know what is exactly going on. So, IBS is more of a waste basket diagnosis. It's very vague, it's non specific, it doesn't explain the why of your symptoms. And I feel like a lot of patients feel dismissed by this diagnosis. And doctors usually use this term when all the test results come back normal. So, why did this term IBS become so popular? It's because the medical system, they want a label. The insurance company, they want a diagnosis. It's the easiest answer when no abnormality is found in your test results or they couldn't find anything which would come back as red or high or abnormal. And your gut is like very complex, but IBS oversimplifies it. Why do I not believe in this diagnosis? Well, because I feel like when somebody is labeled an IBS, it's most likely something else going on and that has not been uncovered yet. Let me explain to you what I mean. So, a lot of people with IBS would have either diarrhea or constipation, or will have some abnormal bowel movements. Or it could be that your bowel movements are completely normal, though that's rare, but you'll have some abdominal symptoms. So, if your symptoms are mostly diarrhea, there are so many things that could be going on rather than just IBS. So, if you have diarrhea associated with IBS symptoms, it could be bile acid diarrhea. Now, this is a diagnosis which is more clinical. Not a lot of tests could be done. Not everyone is aware about it. So, bile acids are produced to digest food. It's produced in the gallbladder and through the ampulla, which is an opening in your small bowel. It goes into your small bowel and then into your colon. We have to remember that bile is an irritant for your gut. It really irritates the mucosa and that gives you diarrhea. But you have to do the bile acid tests for this. The other one is small intestinal bacterial overgrowth. Again, this is a diagnosis where you have to do a specific test, which is called a breath test, which is not available in many centers. So people don't know about this. And even if they suspect it, they usually tend to give antibiotics without testing for it, which I do not feel is the right way. We always need to test because you have to see what kind of gas is this? Is this hydrogen? Is this methane? Is it hydrogen sulfate? And the treatment really depends on that. And also the amount of the gas which is there. So SIBO is another one. Then early inflammatory bowel disease may not show up as exact IBD symptoms. Another one which I see commonly is microscopic colitis. Even if you had an endoscopy or a colonoscopy with microscopic colitis, everything might look normal unless the endoscopist did biopsies, in your colon. Because if the mucosa looked normal and they did not biopsy it, then this can be missed. So even if you had a colonoscopy and everything came back negative, please go back and look whether biopsies were done in the mucosa, because if not, then this could be a diagnosis which could have been missed. Another common one, and by the way, this is so common, I see this so many times, is celiac disease. Because for celiac disease, a lot of the symptoms are very vague. And celiac disease doesn't just affect your gut, it affects your whole body, your joints, your skin, all of that. So for celiac disease, if you had an endoscopy and biopsies were not done in the small bowel, then you cannot rule out celiac disease completely. We have to go back and do the biopsies. And just one or two bites is not enough. Usually we have to take like 6 biopsies in your small bowel to rule this out. 4 from the second and the third part of the duodenum and 2 from the duodenal bulb. What I'm talking about is really the anatomy of your small bowel. And when we do the endoscopy, this is what we see, and we have to do at least 6 biopsies to have proper samples to rule this in or out. And celiac disease is, by the way, a lot of patients don't know that they have celiac disease because the diagnosis is really like the biopsies, and it's difficult. And so a lot of people are just diagnosed as IBS, but in fact, they have celiac disease. So that's one. And then pancreatic insufficiency. So that's another one where a lot of time the gastroenterologist will do the endoscopy and colonoscopies. They will not find anything because when you're doing that procedure, you're not really looking into the pancreas. You're looking inside the lumen of your gut. The pancreas is outside, but pancreas does produce digestive enzymes. So if you have pancreatic insufficiency, that means some of the enzymes are not being produced properly. And that can actually cause malabsorption, which in turn can give you diarrhea and other symptoms. Now, if there is a dysfunction of your gallbladder, that means it's not contracting properly, or there is some inflammation there, that can also give you diarrhea. So keep that in mind too. I want to talk about two things, which I'm seeing more and more in my practice, but a lot of people don't talk about it. It's not like very well documented, but it's true. One is food sensitivity. So if you have food sensitivities, that can give you some diarrhea when you eat that particular food, but a lot of times it's misdiagnosed as IBS. And also remember that if you're sensitive to the food, it's not really the food. That means something is going on in your gut. There could be like dysbiosis, or there could be some increased permeability in the lining of your gut, and that needs to be addressed rather than avoiding the food. If it's one or two food items, I understand, but most of the time I've seen that if you are sensitive to one food item, you can have multiple allergies or sensitivities to food. So that needs to be dig deeper into like what's going on. Another one is histamine intolerance. And again, a lot of people don't know about this. It's not very talked about. When you go to a medical doctor, they rarely talk about this. But in my practice as a gastroenterologist, I see so many patients with mast cell activation and histamine intolerance. And histamine intolerance can give you like very vague symptoms too, associated with eating food, and it will give you diarrhea again, so you might have been diagnosed with IBS, whereas in fact, you are probably dealing with histamine intolerance. Now, it's important to remember that a lot of these symptoms can coexist. So you could have histamine intolerance, you could have food sensitivity, you could have bile acid diarrhea, you could have SIBO, and sometimes I have seen patients who have all of this. And a lot of times we also have to look at the gut microbiome, because I'm seeing more and more of fungal overgrowth and candida issue, which can actually trigger histamine issues and food sensitivities. So this is about diarrhea. So if your bowel movements are more like towards diarrhea, then you could have these issues and you're misdiagnosed as IBS. The other one is constipation. So if you're diagnosed as IBS, but you're dealing more with the constipation symptoms, then what's going on? So chronic constipation means that there is some problem either in the gut microbiome or in the motility of your gut colon. So there could be slow motility, which is called slow transit constipation, or it could be because of dyssynergia or pelvic floor dysfunction. So pelvic dyssynergia or pelvic floor dysfunction means that there is an imbalance in the way the abdominal muscles and the pelvic floors are not coordinated for you to have a proper bowel movement, which causes an obstruction kind of a symptom, and that can cause constipation. Again, if you're not having a lot of fiber in your diet, that could also give you constipation. And of course, our American diet and the way we eat does not allow us to have a lot of fiber. So that's another thing that we need to look into. But if you're eating enough fiber and you're still dealing with constipation and IBS symptoms, then we really need to look at the motility of your colon. Is it moving properly? And also obstructive symptoms. A lot of people don't realize that magnesium deficiency can also cause constipation. So taking some magnesium supplements could help with this. Another one which I see a lot in my practice is the gut-brain dysfunction. I always say that your gut is connected to everything. It's connected to your brain. So if there is a gut-brain dysregulation, then you will deal with constipation. Another common one is the use of medication that causes constipation. So a lot of us are prescribed medications for unrelated symptoms. For example, you could be taking a blood pressure medication that would cause constipation and you don't know about it. So reviewing your medication list and see if those are the reasons why you have constipation is important. Narcotics is another one. And another one, by the way, when you have a fungal overgrowth, a lot of times I see that those patients also have methane SIBO, and they also get very, very constipated. And none of the constipation medicine works on you unless this dysbiosis is treated. So that's the one. Now, if you have mixed bowel movements, that means sometimes you have constipation and sometimes you have diarrhea. So you're switching between diarrhea and constipation. Then that usually means that a couple of things. First, likely post-infectious syndrome. That means you could have had food poisoning or some kind of an infection, and now your body is responding to that. Or it could be dysbiosis. And a lot of people deal with dysbiosis and they don't realize because the symptoms are very vague. There is no diagnosis, like there is no really test to look at it until somebody is really looking into your gut microbiome, which I do in my practice. And if you have any kind of dysbiosis, like bacterial overgrowth, or even the good bacteria are low, bad bacteria are high, or if you have parasites, or if you have fungal overgrowth, then a lot of time your bowel movements will be all over the place. You will have constipation sometimes, and then diarrhea, or diarrhea and constipation. So it's a mixture. And also stress and vagal nerve dysfunction are big ones when you're dealing with a mixed kind of a picture. That means both diarrhea and constipation and alternating between these two. So there are different ways that you can really kind of take care of this. So why it is important to know and not be happy or just satisfied with this diagnosis of IBS. It's because if we don't know the exact reason as to why you have these symptoms, then you won't be able to treat it. And that's why I'm kind of bringing awareness into this, that don't be satisfied with this diagnosis. Do not accept IBS as the final answer. Look for patterns, get the right tests, and work with somebody who looks deeper into your symptoms. Focus should really be on the microbiome, on inflammation, on your motility, your stress levels, and you're looking at you as a whole person and not just your gut symptom. So you're not your symptom, you are a whole person. So we need to look in. If you want a deeper guidance into your symptoms and what's going on, you can join my platform. In this platform, I teach how to decode your symptoms and know exactly what's going on with your gut. I also have my practice in Los Angeles, but if you live far away or if you don't have the time or resources, please check out my platform. This is something that you can do in the comfort of your home at your own pace. And there are live sessions where you have direct access to me and I can go over your symptoms, and there is a community to support you. So check out my platform. I'm leaving the link below, and do not forget to subscribe.